So let me tell you about 3 important areas at the hospital that I think will help you become a part of our team, share in our mission better, and hopefully make your job more enjoyable and fulfilling. And so those 3 areas are going to be our vision statement, our values, and our strategies. Now that may sound kind of dull or dry, but they're very important to us, and I think you'll find that they're meaningful and will help you in your work. So let's start with our vision statement, making exceptional healthcare personal. You're going to see that all over the hospital in newsletters, in articles, on the wall, in publications. So why do we say our vision for this valley is to make exceptional healthcare personal? I think fundamentally it's because as a small rural facility, we believe that we can be excellent at patient care. That you don't have to be a large medical center or a tertiary teaching hospital to provide great clinical care. And if you're a nurse or a clinician or somebody who's going to be working with a patient in any way, you know that you can be excellent here just like you can be at a Denver or Front Range hospital. So our commitment to the Valley is that we're going to provide exceptional clinical care. The last part of that vision statement, making exceptional care personal, is how we're really going to differentiate ourselves. By being personal with our patients, by serving a community where a lot of the people you care for are going to be your friends and neighbors. You're going to know them. And for us, that's a big motivation to being personally engaged with our patients. Patients know and expect that we're going to be good at our clinical jobs and good at our administrative jobs or working in food service or housekeeping or wherever it is you may be working. But what really makes them feel like this is a great place is if we're personal, if we take the time to listen to them, care about them, and they feel like they're not just a patient with an illness or an injury, they're a person that we know and care for. That's why making exceptional healthcare personal is our vision. So number 2, our values. We have 6 values that we embrace for all of us, me, you, everybody else in this organization. And those 6 values are kind of divided up into 3 that we call our foundational values and 3 that are really the values that we think will make us exceptional at what we do. So our first 3 values are integrity, respect, and commitment. And we picked those 3 because we think that if you want to work in healthcare, if you want to be part of caring for people who are scared or anxious or worried or hurting, then we've got to have a lot of personal integrity, and we've got to have respect, and we've got to have commitment. And we call these our foundational values because I think you would agree we don't want to have team members who can't reflect those 3 values. We want to have a group of people who have integrity about caring for their patients. And for us, integrity means, doing the best we know to do. And respect means how I treat you and how you treat me. That respect isn't hierarchy, and I get respect because I'm the CEO, but that you deserve just as much respect from me as I do from you and your coworkers and together. And commitment is treatment of this hospital and our engagement of this hospital, and that we're committed to doing the best we can for this organization. So those are our first 3 values. The other 3 are learning, innovation, and joy. And the reason we picked learning and innovation is because healthcare is a really dynamic environment. You can't practice medicine and deliver care the same way you did 20 years ago. Healthcare has evidence and research and is constantly refining and changing, and our job is to grow and learn and be a part of that. Because when we grow and learn, we can be the best. We can't be the best at what we do if we do the same things we did 10 years ago. So learning is an important part of our organization, and it means that, learning means change. Learning means doing things differently because the evidence or the patients or other people said, hey, I want to be treated differently. I would like this to happen. Innovation is kind of a value of taking that learning and putting into practice. Learning may not do us much good if we don't actually use it. And so we try to be an innovative organization by trying new ways to deliver care that are based on sound judgment and medicine, by organizing ourselves differently, by having innovation in the care and programs we provide and trying new things. And so those two values tell you that this is a dynamic organization and that to work here and to be successful, you've got to be flexible. Our last value is joy. And that very simply is about trying to connect each other to the work that we do really matters. And that when you work here, you have a sense of joy because you know you're making a difference. The last area that I wanted to talk about was our strategies. And I want to talk about one in particular. We have 4, and the first one is a magnet for excellent people. And the reason that's our first strategy is because it's the most important one. No matter what we do in this organization, no matter how great our buildings are or what kind of technology we buy, it won't matter if we don't have great people. And that's why you're here. Because we want you to be part of this team who's delivering great care to people and to people who need us so much. And we know that if we have great people, we'll be a great organization. So we're super glad to have you here. We're glad you chose to join us. We hope this is a great job for you, whether it's a career for you or whether it is a temporary step to some other place in your journey. So thank you for being here. Please know that I'm available. I have an open door policy. I'm available for any questions or concerns, and so is the rest of my management and leadership team. I hope you have a great experience at San Luis Valley Regional Medical Center.